Breaking news. The World Health Organization is ending its global emergency declaration for COVID-19 that it declared more than 3 years ago. The WHO says that their emergency committee recommended to end the public health emergency of international concern yesterday, and the Director General has accepted that advice. Nearly 7 million people have died from COVID-19 since the WHO first declared the emergency in January 2020, and hundreds of millions have been infected. The pandemic triggered unprecedented lockdowns, upended economies, and ravaged communities around the world. The WHO does say that while the emergency phase is over, the pandemic has not ended, but they say that the virus no longer poses the same danger it once did. The World Health Organization Director General is saying that the world needs to be better prepared for the next global health crisis.
The world was not well prepared when this pandemic hit, and with the pandemic accord, we can be prepared better. And the pandemic accord should be based on the lessons learned. So if there is real commitment not to make the same mistakes again, the presence of an emergency, peak or not, doesn't matter, because for the last 3 years we have already learned the lessons.
Joining us now for more is Dr. Isaac Bogoch, Infectious Disease Specialist. Dr. Isaac Bogoch, good to see you. It's been quite some time. I want to get your reaction to what the WHO has declared today.
Yeah, I think there's some mixed emotions and a few thoughts. One is, it's great to see that we are moving forward in the sense that this is no longer declared a public health emergency of international concern. And obviously, the COVID is very different right now than it was when it first emerged. On the other hand, I think it's a point to reflect that when we look at the modeling, over 20 million people have died, over 50,000 Canadians have died. This has had a tremendous impact, not just on health, but also, of course, mental health and well-being of so many people around the world. And that, of course, COVID is still here, even though this is no longer a public health emergency of international concern. It's not going away, and we're going to be contending with waxing and waning virus for an indefinite period of time. So we have to, build better structures and have capacity to deal with this, because it's still going to continue to disproportionately impact older individuals with underlying medical conditions, and we're still going to be facing this virus, even though it no longer constitutes a public health emergency of international concern.
Right, and we want to clarify that the WHO is saying that the pandemic, it's still a pandemic. The emergency declaration may be over, but this is still a pandemic. We were just looking at those numbers there, and I wanted to ask you about how we're tracking the course of COVID-19 throughout the country, because 52,000 people have lost their lives, more than 52,000 people have lost their lives to the virus in Canada. Of the cases we know of, 4.6 million cases in Canada. Let's talk a little bit about how we, over the course of the pandemic, changed the way we track this virus and how confident we can be as to where we are in the course of the pandemic.
Yeah, it's been very challenging because we have scaled back a lot of the testing that has been done. And, again, the data is very important. It's also important to contextualize the data and interpret it, and then have data-driven and sound responses. We're actually doing some very interesting things in Canada, and we're relying more heavily on wastewater surveillance, which is extremely helpful. It's cost effective, and it gives you a good idea as to how much COVID is circulating in various communities at various times. So I think that's helpful. Obviously, everyone watching is well aware there's just less testing of individuals, and that unfortunately doesn't help us that much. But the wastewater surveillance is helpful. It gives us geographic coordinates of where we see COVID. It can give us a bit of a heads up as to where we might see more COVID before we start to see it spilling over into hospital environments. And it can give us an understanding of the burden of COVID in various communities.
Okay, we do have to leave it there for the interest of time. We always thank you for yours. Infectious Disease Specialist Dr. Isaac Bogoch, thanks so much.
Thank you.